Welcome to this video on the passages and openings of the skull. And these passages and openings just include things like the foramina, fissures, canals, and grooves. And I've color-coded each of them on the skull diagrams, so it's just easier to spot them. And this is part one of the video because it's actually quite long, this topic, so I've split it up into two parts. Okay, so what are the differences between these things? So a foramen is a round hole that goes through a bone, and a fissure is a slit that goes through a bone. So foramens are round, and then fissures are just kind of like long. Canals are tubular passages or tunnels that go through bones. So these tend to be really like long and they go all the way through, whereas foramen tend to be quite small, like much smaller. Grooves are long and narrow indentations in the bone, and so they're not actually holes, they're just kind of indents which are like shallow depressions. And other passages and cavities include meatises, which are just openings into canals. So if anything opens into a canal, it can be called a meatus. And sinuses, which are air-filled spaces that are in bone. Okay, so this is the anterior view. And if we look at the anterior view of the skull, I know there's a lot on here and it looks complicated, but once we break it down, it gets pretty easy to remember. So the first one we're looking at is the supraorbital foramen. And the supraorbital foramen is here. The supraorbital foramen, it's sometimes called a notch because it might not be as deep. So it's here. And it's on the frontal bone. So we know that this is the frontal bone. So it's on the frontal bone and it's above the orbit. The orbit is here and it's just above the orbit. So it's called the supraorbital foramen. Supra because it's superior to the orbit, which means it's above the orbit. Okay, so it's on the frontal bone, and the supraorbital arteries and veins pass through it, and the supraorbital nerve passes through it. So it's quite easy to remember. Supraorbital arteries, veins, and nerves pass through the supraorbital foramen. Okay, next, let's look at the infraorbital foramen. Now, the infraorbital foramen is located here, and it's located on the maxilla. So this is the maxilla. It's located on the maxilla, and it's found just below the orbit. So we have orbit here, and it's just below. Remember, inferior means below, so infraorbital means it's below the orbit. So it's located on the maxilla, and it carries the infraorbital arteries and veins and infraorbital nerves, just like the supraorbital ones. It carries like what it has in the name, that's what it carries. Okay, next, we're going to look at the supraorbital fissure. And this is quite detailed. We need to know this in a bit of detail. This is here. It's this canal here. So it's kind of like a passage. And it's found between the greater wing and the lesser wing of the sphenoid bone. So it's found between the greater wing and the lesser wing. This is the greater wing. And the lesser wing you can't really see, but it's kind of down here. So the greater wing and lesser wing. And it has loads and loads of things passing through it. So it's actually like in the orbit. You can see it through the orbit. So located on like between the greater and lesser wings of the sphenoid bone. And it has the superior and inferior ophthalmic veins passing through it. And the nasociliary, frontal and lacrimal branches of the ophthalmic division of the trigeminal nerve. Okay, and it also has the oculomotor, trochlear, and abducens nerves passing through it. And this here is just a mnemonic that you can use to remember these by. So remember, the ophthalmic divisions include the nasociliary, frontal, and lacrimal branches, as well as other nerves such as oculomotor, trochlear, and abducens. Okay, just like the supraorbital fissure, we have the infraorbital fissure, and that is here. So all the fissures are in purple, so that's here. And that's like on the floor of the orbit. So here and here. Okay. So this is found below the supraorbital fissure, and it lies on the floor of the orbit. and it's found between the greater wing of the sphenoid bone and the maxilla and orbital portions of the palatine bone. So this should actually say palatine bone. But it's actually found on the maxilla and orbital portions of the palatine bone. Now, it transmits the infraorbital artery, which comes from the maxillary artery and the vein, and a branch of the inferior ophthalmic vein, and loads of emissary veins that connect it to the pterygoid venous plexus, which is a term that we'll come across later. And the nerves it transmits are the infraorbital nerve and the zygomatic nerve, which come both from the maxillary division of the trigeminal nerve. There's loads of keywords, but, as we go through it, it'll get kind of easier, hopefully. I'm hoping at least. Okay, next we have the optic canal. And the optic canal is here. So canals are in green. Optic canal is right there. And it runs at an angle through the lesser wing of the sphenoid bone. So like lesser wing of the sphenoid bone. And so it runs at an angle through the lesser wing of the sphenoid bone, and it transmits the ophthalmic artery and its associated fibers. It also transmits the optic nerve. This should say optic nerve, sorry for that. Optic nerve. It transmits the optic nerve. Okay, now the ophthalmic artery actually lies below and next to, so we say it lies inferior and lateral to the optic nerve inside the optic canal. So actually inside the optic canal, we'd have the optic nerve so if this was the optic canal and this was the optic nerve here, the ophthalmic artery would be below and next to, so it would be like here within the canal itself. The actual canal opens up to the skull base at the optic foramen. Okay, next we have the posterior ethmoidal foramen. So the posterior ethmoidal foramen is located here. I don't think they've actually labelled it properly on this skull, so I just kind of did a dot, but it's somewhere around here. And it's just a small opening between the frontal and the ethmoid bone. So it's called posterior because it's like posterior is kind of above and behind. So this is actually 3D. Obviously the orbit is 3D and it goes deeper as it goes in. So posterior just means like behind. So this one would be behind this dot here, which is called the anterior ethmoidal foramen. So this one's posterior because it's behind, and this is anterior because it's in front. But it's hard to see, but actually it's 3D, so you'll be able to see a lot better. So the posterior ethmoid foramen is between the frontal and ethmoid bones, and it transmits the posterior ethmoidal artery and vein, as well as the posterior ethmoidal nerve. And this is what supplies the posterior ethmoidal and sphenoid sinuses. So the posterior ethmoidal nerve supplies the posterior ethmoidal and sphenoid sinuses. Okay, and like we mentioned before, this is the anterior ethmoidal foramen because it's found in front, and this is also between the frontal and ethmoid bones, and it transmits the anterior ethmoidal artery and vein and the anterior ethmoidal nerve. So just like the posterior, except it's called anterior this time. Okay, next we have the zygomaticofacial foramen. And that's located here, where the laser's at. And it's a small foramen found on the zygomatic bone. So these are the zygomatic bones, found on the zygomatic bones, and there's 2 of them. And it transmits the zygomaticofacial artery and vein, as well as the zygomaticofacial nerve. And this nerve is a branch of the zygomatic nerve from the maxillary division of the trigeminal nerve. So the zygomaticofacial nerve is a part of the zygomatic nerve, And the zygomatic nerve comes from the maxillary division of the trigeminal nerve. So maxillary division would just mean the part that's actually like seen or goes to the maxilla. So maxillary division of the trigeminal nerve. Okay. And finally, we have the mental foramen. Now this is the mental foramen here. And there's two of them. And these are found on the mandible. So this is the mandible, found on the mandible. And they're normally next to the mandibular root of the second premolar. So normally next to this, the mandibular roots of the second premolar. And yeah, so it carries the mental nerve, which is a terminal branch of the inferior alveolar nerve. So the inferior alveolar nerve actually comes from the inferior alveolar canal, which is like here. And the nerve will go down this way. And then when it gets to around the mental foramen, it will turn into the mental nerve. So yeah, it also contains the mental artery and vein. And all of these things will leave the mandibular canal through the mental foramen. So they'll exit through the mental foramen. Okay. Next, we're going to look at the superior view of the cranial base. And yes, this is a lot more complicated, but this is like after this slide, it's the end of part 1, because I'll cover the other two kind of surfaces in part 2. So, if we start from the top, the foramen caisson is here. It's located here, and it's found in the anterior cranial fossa. So this part is the anterior cranial fossa, which is just anterior, just means the front, so the front part of the cranial fossa, and it's between the frontal and ethmoid bone. So it's between the frontal and ethmoid bone, and there's an emissary vein that goes through it, and the emissary vein travels from the nasal cavity to the suprasagittal sinus. So it's going from the nasal cavity to the suprasagittal sinus, and it just passes through the foramen caisson. I think I'm saying that right, I'm not sure. Okay, next we have the cribriform plate foramina. So that's all these little foramina you can see here. You can see all these little dots. And this is on the ethmoid bone. So the cribriform plate itself, which is this part, the cribriform plate is on the ethmoid bone, and it looks kind of like a sieve because it's got just loads of little holes, and it's like dotted with foramina. And these foramina, they carry the olfactory nerves from the olfactory bulb. So the nerves come from the olfactory bulb, and they go through the cribriform plate foramina. Okay. Next, we have the optic canal, and this we've already covered in the one before, so that's just located here. We can see it's coming from, so the optic canal was here, so it goes from this bit at the front, and this is where it comes out of the back, the optic canal. No, sorry, the optic canal's here. Ignore that, the optic canal's here, it's not up there. So this is the optic canal. Okay. Now, we also mentioned the posterior and anterior ethmoidal foramen. We talked about that here. We have the posterior ethmoid foramen and the anterior ethmoid foramen. And there you can see, like, this is the anterior ethmoid foramen. It comes out this way. And then the posterior is just at the back. Okay. Now, the foramen rotundum. Let's talk about that. The foramen rotundum is located here and here. So it's just below the optic canal, or kind of like laterally, so to the side of it. And it's found in the middle cranial fossa. So this bit here is the middle cranial fossa. And it's on the sphenoid bone. The middle cranial fossa, like the sphenoid bone, is on it. So if we look at the foramen rotundum, so it's in the middle cranial fossa on the sphenoid bone, and it carries the artery of the foramen rotundum and emissary veins, as well as the maxillary branch of the trigeminal nerve. Okay, next we have the sphenoid emissary. And the sphenoid emissary is just below the foramen rotundum, and it's also sometimes called foramen vacilli, and it's found on the greater wing of the sphenoid bone. So this is the greater wing of the sphenoid bone, and it's just right here. And yeah, greater wing of the sphenoid bone, and it transmits a sphenoidal emissary vein that kinks the pterygoid venous plexus in the infratemporal fossa to the cavernous sinus. So it just means that the pterygoid venous plexus, which is in the infratemporal fossa, so the inferior temporal fossa, it will just bend it. So it will just bend it, which means like kinks it. It will bend it so that it will actually travel to the cavernous sinus or cavernous sinus. Okay, next we have the foramen ovale. And you can see that right here, it's quite big. The foramen ovale is quite a large oval-shaped hole. So, yeah. So, it's a oval-shaped hole or opening in the middle cranial fossa, and it's located on the greater wing of the sphenoid bone. The vessels it carries are the accessory meningeal artery and accessory veins. Emissary veins. This should be emissary, not accessory. And emissary veins, as well as the nerves that are the mandibular division of the trigeminal nerve, which is also known as V3, the otic ganglion, which is one of 4 parasympathetic ganglia, and sometimes it can also carry the nervus spinosus. And nervus spinosus just means the meningeal branch of the mandibular nerve. And it can also carry the lessopetrosal nerve sometimes. So there's so much to learn. So there's actually a mnemonic to help you remember this, and it's called ovale. So O stands for otic ganglion, V stands for V3, which it just means the mandibular division of the trigeminal nerve. A stands for the accessory veins. I think it should be accessory, not emissary. Let me just correct that. Sorry for that confusion. It should be accessory veins. The lessopetrosal is the L, and the emissary is the E. Oh, I'm just getting myself confused here. So it has accessory veins and emissary veins. Yeah. So it has accessory and emissary. That's why I was a bit confused. Okay. Next we have the foramen spinosum. And this is located just below the foramen ovale. It's smaller. Just below the foramen ovale, and it's also found on the greater wing of the sphenoid bone. And this transmits the middle meningeal artery and vein, as well as the nervus spinous, which nervus spinosus, which is the meningeal branch of the mandibular nerve. Or if you want to be a little bit more detailed, it's the meningeal branch of the mandibular division of the trigeminal nerve. Yeah, that's the nervus spinous, meningeal branch of the mandibular division of the trigeminal nerve. Okay, next we have the foramen lacerum. So it's right here. The foramen lacerum is here, and it's quite big. So remember, this was ovale. This was spinosum on the end. Ovale is oval-shaped, and this is lacerum. And it's actually triangular. So it doesn't really look it, but it's actually triangular. So it's a triangular foramen in the middle cranial fossa, and it's not actually a true foramen, it's actually a gap. So this gap is filled with fibrocartilage, and fibrocartilage is a type of connective tissue. Now, nothing actually passes through the foramen lacerum, but within the foramen, so inside the actual foramen, the greater petrosal nerve joins the deep petrosal nerve. Okay, next we have the hiatuses for the lesser and greater petrosal nerve, that's here, and these you can see over here, right there, and they're like little lines. They're quite hard to see, but they're there, and they're next to the carotid canal, which we'll cover. So yeah, the hiatus for the lesser and greater petrosal nerve, and these hiatuses are found in the petrous part of the temporal bone. So both of them are found in the petrous part of the temporal bone, and they carry their respective nerves. So the hiatus for the lesser petrosal nerve will carry the lesser petrosal nerve, and the hiatus for the greater petrosal nerve will carry the greater petrosal nerve. Okay, like I mentioned before, just above that is the carotid canal, right here, in green. And the carotid canal is, it's a passage within the petrous part of the temporal bone. So all of this is the temporal bone here. And it's on the petrous part of the temporal bone. And it transmits the internal carotid artery and the sympathetic plexus, which just means the internal carotid nerve plexus. So that's what the sympathetic plexus is. It's the internal carotid nerve plexus. Okay, next we have the internal acoustic meatus. Internal acoustic meatus, and that you can see is highlighted in red over here. It's quite large, actually. The opening is kind of right here, like that. It's quite large, and it's in the temporal bone. So it's a bony canal in the temporal bone, and it carries things such as the labyrinthine artery, and also many components of the facial and vestibulocochlear nerves. You don't need to know all these different components, but just remember that there's so many components of the facial and vestibulocochlear nerves that go through it, as well as the labyrinthine artery. Okay, next we have the external opening of the vestibular aqueduct. And this is kind of below and like next to, so lateral to the internal acoustic meatus, and it's right here, and it's a structure of the inner ear, actually. So this is obviously on the temporal bone, and it's actually a structure of the inner ear. So the vestibular aqueduct itself is an inner ear structure, and the external opening of it transmits the endolymphatic duct. Okay, next we have quite an important one, which is the jugular foramen. And the jugular foramen can be seen here and here. So there's two of them, jugular foramen. And it sits between the petrous part. Petrous just means flat. So if anything is petrous, it just means it's like, well, not really flat. It just means it's kind of like bumpy, rocky, like stony or rocky. So that's what petrosal means. So petrous is like the bumpy, like raised kind of, part of the temporal bone and the occipital bone. So it sits between petrous part of the temporal bone and the occipital bone. That's here. Yeah. And it's actually made up of two parts that are divided by something called the jugular spine. It contains the inferior petrosal, sigmoid, and posterior meningeal sinuses. So all of these are sinuses. You have the inferior petrosal, you have the sigmoid, you have the posterior meningeal, and these are all sinuses. And it also carries the glossopharyngeal, vagus, and accessory nerves. Now, you have the hypoglossal canal, which is right here, which is next to this massive opening, which we'll talk about. And this is on the occipital bone. So now we're on the occipital bone, which is like the back. And so it's found in the occipital bone, and it allows the hypoglossal nerve to exit via the posterior cranial fossa. So this is the posterior cranial fossa. We have the posterior cranial fossa, middle cranial fossa, anterior cranial fossa. So it just allows the hypoglossal nerve to exit. Then we have the condylar canal here, And this is quite small. It's just this little green dot that you can see, the condylar canal. You can't really see it on the skull that much, but it's there at that position. And it's also found on the occipital bone in the condylar fossa, which is this part here. Condylar fossa. And it's actually the largest of the emissary foramina in the skull. So it's the largest of the emissary foramina in the skull, which means it carries emissary veins, and these emissary veins connect the sigmoid sinus to the occipital vein, and it also carries the meningeal branch of the occipital artery. Finally, we have the really big one, and this is called the foramen magnum. Magnum because you can think of anything it's got a really high magnitude, means it's really big, and that's just this massive opening here. And so it's the largest foramen in the skull, and the medulla oblongata actually travels across it. The medulla oblongata is a part of the brain, and it carries the vertebral arteries and a venous plexus, which is a complex set of interconnected blood vessels. So it carries the vertebral arteries and something called the venous plexus, which is a complex set of interconnected blood vessels, and also carries the spinal roots of the accessory nerve. Okay, so that's all there is for this video. So in this video, we covered the anterior view and the superior view and all the foramina that are included. And in the next video, we're going to be talking about we're going to be going into the posterior view and the inferior view and look at all the foramina on there. That one will be a slightly shorter video because this one had the bulk of the information in it. Thank you for listening. I hope you learned something.